As we all know, the governor's roundtable has become an important milestone in the partnership between civil society organizations operating in Nakuru and the county government of Nakuru. This idea was mooted way back when at the onset of the county government with the first administration, and we started so well. I remember we held a total of around 4 meetings with the county government then. At the beginning of this administration, this is the 3rd meeting that we are holding. The very first was held in 2018 when we just did an introduction, the new administration, just to understand how the relationship has been between the civil society and the county government. And I think this is we are a pioneer county to have this kind of arrangement, and this has really been recognized even nationally, where Nakuru County has been recognized as one of the counties that has really opened up space for participatory approaches and involving of various stakeholders within and outside government. So the theme of our meeting, and the first one for this year, revolves around the COVID-19 pandemic. You all know that by mid-March last year, as a country was stuck, and we reported our first case of COVID-19. And this really put government in motion by embarking on a series of measures to try and contain the devastating impact or effect of this pandemic. Broadly, we'll seek to reflect on how we performed as a county, and more importantly, formulate practical and effective mechanisms for implementation of the engineering and recovery strategy for Nakuru County. So the civil society have been doing a bit in terms of their contribution, and they'll take this opportunity to share with the government their feedback on what they think is happening, what is working well, what's not working well, so that as stakeholders in this business, we are able to come up with very clear and practical mechanisms moving forward.
Because I have been with this journey with the civil society organizations for some time, I would want to say that we are losing a very big opportunity as a people by not operationalizing the PBO Act that was done in 2012. It would have given a very good opportunity for NGOs and even for government to have greater framework of raising resources and engaging with the development partners so that we are able as a team to work towards better results in managing our people. We are now getting used to the COVID dispensation. We need to ask ourselves, and I think we raised this matter here before, that we need to ask ourselves what opportunities there are in us engaging with the community so that we make our people better.
And I can see and admire the collaborative nature in which the county government and civil societies in Nakuru have been working. This is an deviation from the previous school of thought, probably where any governmental organization and civil societies could never see eye to eye, but look like it is antagonism. No one wants to hear the other side. But what I can see here today, I think, is what every Kenyan would want to see, the kind of things that we can share. And probably do a little bit of polishing, because we have something to learn from each other. Now, when we talk about corruption, sometimes people complaining of harassment, but then they are not telling you, they are not offering themselves to be taken to court without your mask. Sometimes if you are my friend, you are calling me and telling me that, bwana, nisaidie niachiliwe hapa, nilikuwa nimeweka tu kwa mfuko. Is that not corruption? Yeah? Anytime civil societies want to meet security organs in Nakuru, I will organize and bring them to you so that you can inquire anything that you want. Yeah? And we'll give answers. All that I'm saying, we are willing to work with you. We are open doors, not any information that we can cover. Let us join hands so that as Nakuru County, we can contribute also to the well-being of this country.
Mine is to assure you that as civil society, we are committing to strengthening cooperation between government and ourselves with the sole purpose, as you rightly put it, of enabling Kenyans to live within the realms of the law, particularly what you cited as the rule of law. So, yeah, Mark, that's it from me.
Thank you.
For us as a county, two sectors were hard hit. One is the hospitality sector, and this is mainly the hotels and the bars, the entertainment industry, especially our hotels in Naivasha, which thrived for a long time on international arrivals. So the immediate impact was some of them were forced to close down, in the process lay off their workers, which also now brought other livelihood issues. And what we decided as a county was, as the first step, we try and mitigate some of the challenges they were facing. So what we did, we came up with a stimulus, an agricultural stimulus, whereby we went out and provided food to households. And what we did, as the county commissioner mentioned, we had a steering committee, a county COVID committee at the top. And then now we went to the various wards where we were able to have ward committees. And the ward committees were able to tell us within the respective areas what were their needs. As I said earlier, we managed to reach 140,000 households in all our 11 sub-counties. As we move forward, I think we've been told that COVID is the new normal. So we have no option but see how we are going to work within. We are happy that some of the restrictions were relaxed, but I think still for the hospitality sector, it is still a challenge. In conclusion, I just want to pledge my own support and that of the county. And I think, as has been said, we have had a good working relation with civil society. And we hope that the same will be able to continue going into the near future.
We want first to thank everyone in Nakuru for having been good, because our approach to COVID-19 was four-pronged. One, health promotion. We went out of our way to sensitize people, and this included everyone, including the civil society, the churches, and that was good enough. The second thing was prevention, because the idea behind not having very many in hospitals is having preventive measures. Having said that, then we went now into the clinical aspects. Some people had to be sick at some time, and we put very good measures in home-based care isolation, and also putting people in our treatment facilities. Cumulatively, we have confirmed 5,026 cases, accounting for 4.6% of the cases reported nationally. We might look high, but it is because we've gone out of our way to test more people than anybody else. We have 0 deaths recorded in the last 24 hours, but in total, we have lost 103 people to COVID-19 up to yesterday. Part of the reason why we have a high figure is because counties surrounding us refer here their worst cases, and most of them succumb while they are here. Our current admissions as of today are 25, and 17 are on oxygen, and a few are in ICU. Encourage our people. The phase which we are going to is a bad one. I am not sure we are prepared well enough to handle everyone. If we have 500 beds, we have 40 ventilators, we have 20 ICU beds dedicated for COVID patients, and we have a population of 2.2 million, then you can do your calculation. We are not prepared well enough. And this is not for Nakuru County. Even the US, Western Europe, you see TV and you see what is happening.
One of the things that we've been thinking about very, very keenly is about information sharing. And what we've noticed that over time, especially when you are coming out of this season of COVID, is that we require to know where there are new emerging opportunities and where there are new avenues where we can be able to tap in for more revenue and business opportunities. And what I would say is that unfortunately sometimes, I think, and maybe this is something that we need to work out of this COVID situation, it has somehow also pushed various groups into silos. So people operating within their confines. So if it is a CSO, they are in their corner saying that this is how we are intervening on COVID. If it is a business, this is how we are intervening on COVID. So if we can be able to improve on information sharing, that way we are able to all pull each other up, because we cannot be in all facets. For instance, business is not very good sometimes in giving relief support to the communities. But we can be approached and say, through the funding as CSOs we have received, could you, at this discounted rate, give us these particular goods? We want to be engaged more effectively. We have huge projects. We have the inland port at Mai Mahiu. We want to know more about that. We have the airport. We've seen a lot on media, but little conversation in the business community, what's going on there. We also have the highway, which is coming up. Those guys are on the ground. We hear them here and there, making private discussions, but there should also be a community discussion so that the businesses within the county benefit, especially, like that's a big program, that's 180 billion. County should fight to have at least 50, 60 billion of that coming into Nakuru County.
The pandemic, the 2020, was a significant year in history for our businesses and manufacturing sector. Our adaptability and resilience was severely tested. As you know, most of the businesses, most of the manufacturers, some closed down, while others played a very big role. We saw the impact of COVID-19 thriving by giving some opportunities for innovations. Like we saw Bed Investments Limited come up with the PPEs to contain COVID, which was an internal innovation. And we believe that that was quite commendable. We had our manufacturers come to the forefront to be able to donate whatever they had. They gave out foodstuffs, they gave out soap, they gave out anything that they could, also in support of the county government to help them also contain the pandemic, and also fought quite hard to keep employees in employment. As we can see, many of them, some were laid down, and others up to today are struggling to come to terms, while manufacturers in Nakuru really tried to keep employees working, and I believe that was also a way of maintaining our society. However, this was heavily felt in the second quarter, whereby our output dropped from 191 million to 183. We also had a big drop to 3.2%. And we would like to say that though this was a challenge that was felt worldwide, we have tried. We need to wake up in 2021, dust ourselves, hold on to what we have learned, adapt and adjust, and see the way we can be able to move forward. As we work together as a team, I want to believe that we will be able to make a step forward. And though we were hard hit by the COVID-19 to date, but I believe that we can still move. We will not stay in one place and say it is COVID.
From where we sit as civil society, some of the issues that stood out for us were structural challenges COVID-19 kind of exposed some structural challenges in the health sector. For instance, inadequate staffing, inadequate medical equipment, weak community health strategy, weak mechanisms for multi-sectoral or stakeholder coordination and collaboration. We also experienced, and it was not only in Nakuru, but across the country, in many counties, we saw industrial actions by our health workers, and that strike may have actually made it difficult for our residents to access healthcare services during COVID, and that worsened the situation. There were also mental health issues. We saw a rise in gender-based violence, which could be an indicator of mental health issues in our community. Suicide rates, I think all of us have witnessed every day on the news. There are cases of suicide. Then the increase of GBV, abortions, suicides, divorce, separations in families, all these issues, though some of them happen at the family setup, have a bearing on our operation as a county. Then we also take note of access to water. While hand washing was a key COVID-19 prevention measure, there was a serious gap in access to water in high demand areas, including informal settlements and public spaces such as markets and bus terminals. Then there is also the issue of community perception. Especially during COVID, there were people who feared to go to health facilities because they perceived that those health facilities are COVID-19 hotspots, or they would be exposed to COVID-19. The other key issue is social protection, and there are several things that came out in terms of social protection. One of them, I've mentioned it under health, but it is also a key issue in social protection, and that is gender-based violence. We also noted some statistics that reports of sexual and gender-based violence in Nakuru County increased by about 45%. There is also an issue of access to justice, especially for vulnerable communities. Court sessions were held virtually, and so there were some groups, particularly in low-income households, that were not able to adopt quickly to the new norm of using technology. So you find that some were missing out on court sessions. The downscaling of judiciary activities also contributed to delayed access to justice. Poor coordination among various actors in supporting vulnerable groups like PWDs, children, persons living with HIV during COVID pandemic. Key issues observed included duplicated efforts, a lack of equity, but also there was a concern around the quality of the relief items that were distributed. There is also an issue on police harassment. There were notable cases of harassment and human rights violations by COVID and enforcement officers as identified and documented by various CSOs. The next pillar is on economic governance. I'm looking around because Evans is our budget expert, and I want to give him a few minutes just to share with us the issue on economic governance. Thank you.
On budget transparency, I think Nakuru has been ranked badly in terms of displaying information or facilitating access to information. If you look at, there is a map there just before that map. You can search for it online. This is a survey that we have been doing year in, year out. The last was done in 2020, which was on comprehensiveness, but this one was for 2019. The 2021 is yet to be out. Again, when it comes to COVID-19 expenditure, the Control of Budget shared a brief report on how the county fared in terms of COVID-19, but I think the challenge was details of what was spent and how much for each of the items. But then as CSOs of the Auditor General reports, the Control of Budget reports has shown some gaps that we feel like this is the time to fix these gaps even the more because of the revenue challenges anticipated. On COVID-19, Nakuru County registered the highest expenditure among the 47 counties of what was spent of the COVID-19 allocations. We also note that the around 201 million was not spent from the national conditional grant. So we had this grant 512. Part of it came from the national government as a conditional grant. Part of it came from the county supplementary budget. So we appreciate that the national government conditional grant was not spent because of lack of structures. So I think a lesson to pick is that maybe as we budget for this year, let's anticipate this and maybe factor it in our budget. On transparency, I think I've emphasized it. And for avoidance of doubt, Section 166 of the PFM Act requires the county to publish quarterly budget implementation report. At the end, 1 month after each quarter, we should have a report published and publicized. So this is an area that we'll continue to push. And also, if you need any support from the CSOs, we'll work together to see that this provision is met. Otherwise, citizens will continue to remain in the dark. Thank you.
Some of the actions that have been taken by government and CSOs, and I'll just start by highlighting the key. This list is by no means exhaustive, but we've just highlighted the key actions that we saw the county government take and CSOs take. So we saw efforts to create awareness on COVID-19 through different medias and community health strategy. Evans has already talked about development of a supplementary budget where we got resources also from national government, around 512 million. Establishment of the COVID-19 coordination and response team. Distribution of food and non-food items to vulnerable populations and installation of hand washing facilities in strategic locations, high traffic areas. Then we also saw enforcement of COVID-19 protocols and contact tracing. We're not sure whether contact tracing is still ongoing. Perhaps our CC is going to tell us. But at least in 2020, we saw a lot of contact tracing efforts being undertaken. Sorry. Then we also saw expansion of bed capacity in health facilities and establishment of isolation centers. There were also efforts to train health workers and hiring of COVID-19 response. Then we also have some actions that CSOs undertook. One of them is monitoring and documenting, as well as reporting human rights violations. We also had a referral mechanism for people whose rights were violated. We also had media campaigns. A lot of CSOs used radios, printed posters, used social media to sensitize the community or our residents on COVID-19 safety protocols. There are also efforts to create awareness on mental health and also provide psychosocial support to affected citizens. Provisions of several things, for example, comprehensive and age-appropriate sexual reproductive health to our teenage girls, food and non-food items to vulnerable households, provision of dignity packs also to vulnerable adolescent girls and young women. There were also CSOs that stepped in to provide protective personal equipment to our communities, specifically masks. And then masks, and also there were CSOs that supported installation of hand washing facilities in different parts of the county. County government of Nakuru, as part of the 47 counties, needs to begin or has already started, perhaps we will hear that, but there is need to join hands in implementation of the COVID-19 re-engineering and recovery strategy for 2020, 21, up to 2022, 23.
With the civil society organizations in realization of the tenets of the Constitution and the County Government Act. Because we know that development projects initiated in government, whether it's in national government or at county level, is subject to accountability and transparency. And so this is in conformity with the law. I also know that the purpose of the round table, breakfast by the governor is to provide a platform for accountability and sharing of information on the progress of the county in implementation of identified programs, to review and provide feedback on implementation of identified policies and programs, to formulate policy proposals to address identified gaps in the implementation of county programs, to identify and formulate joint mechanisms for NACSOF contribution in county development programs, and to advise on adoption of best practices in service delivery based on national, regional, and global standards.
But it's now the occasion for us to launch the report. I think the report that we're going to launch is the Nakuru County Health Sector Social Audit Report. And I'm going to request the county attorney to read out the name of the report.
So, ladies and gentlemen, I'm joined here by my colleagues from the county and representatives of NACSOF to officially launch the Nakuru County Health Sector Social Audit Report for 2021. Thank you very much, and may God bless you abundantly.